Grooming, continue with the normal routine as much as possible. And, as I was saying, the routine of, does this person like to, wash their face, comb their hair, get dressed, and then go have the breakfast, or do they like to lounge in their housecoat, then go back after, so keeping the routines. Reduce clutter, having the necessary items or equipment there only, not having things that are not needed mixed together, because then you have to figure out where the comb is or the brush, but it could be right there, for easy access. Toileting, is the person able to communicate his or her needs to the toileting, and it's important to keep that in mind, because, and especially if it's a family function and it's been a couple of hours, you may need to be aware of that. It's as some people need to have reminders and other people don't. Are the bathrooms and the hallways well lit? Again, we don't want anybody to fall, so safety is always in our minds. And again, as even with the meals, having foods that are able to be tolerated. And you'd have your bathroom, your hallways well lit. Again, as I mentioned, maybe a rail in the hall is important. Using contrast colors, again in the bathroom for the toilet seat, as depending on how a person's illness progresses. So some of these things may seem a bit far-fetched, but everybody's illness is different. Choose easy to remove clothing. For safety, consider installing I'm ahead of myself, the handrails, and the raised toilet seat is wonderful, because the effort and energy to move, to stand, because as people get older, they may have dementia, but they may have arthritis with that, and then they might have high blood pressure. So there's lots happening inside a body, and making activities of daily living easier is better for everybody. In the event of an accident, it's important not to get angry or to draw attention to what's happened. It's really important, and it can be something as simple as the water got spilled on the table, or something got put in the wrong place. I've often had family members say, but milk was in the cupboard and it wasn't in the refrigerator. Again, staying calm and not having a big fuss over something that's simple, because when you need to consider this chronic illness, and everybody progresses at a different stage. Consider choosing activities, skills, abilities, interests, and past hobbies. A lot of Newfoundland people enjoy cards, playing 45s and 120s, and I have an auntie who was 94 last year, and we had great, and she has a form of dementia, but we had great times playing cards and many laughs around the table. So, those skills are there for a long time. Stages of the disease is always important to keep in mind with our loved person. What brings pleasure to the person? And in our families, we know what our family members enjoy doing, so it's really important to remember those kind of things and doing them. Be it going for a walk this time of year when the blossoms are coming out and all the smells are in the parks of all the lilacs and different, it's important to do things that the person has always enjoyed. They may not express that this is the time of year that they would like that walk. Activities a person can begin on their own. So whatever those activities, if you remember to write them down, what they like to do on their own. Physical limitations of the person, again, is really important. When you're choosing an activity, it's frustrating if you do an activity that the person can't do and keep up with. Then nobody enjoys it, and we want to have activities that everybody enjoys, and it could be playing darts, it could be playing bowling, depending on the age of the person. There's lots of resources available, and is the environment safe? I can't express that enough. It's really important to think safety for our family member or our friend. Your strengths and limitations as a caregiver, it's always good to know what you can handle and what you can't, and activities that you are comfortable with and could do. I could not play darts with somebody because I can't hit the wall, or I can hit the wall, I can never hit that circle. So it would not be a good activity for me to do at all. So it's important to know our limitations. Successful activities have a purpose. They're familiar, everyday activities, are they? Have a strong and rhythmic component. It gives feedback and a sense of success when everybody enjoys the activity. Engage the person directly, and they tend to be concrete and predictable. So, that's what an activity should, we should end with. And everybody feels good for that during that time. And you can see Our Lady there is doing some stretches or some yoga. Activity hints. Break things down into small steps. Again, as I mentioned earlier in the presentation about comprehension, which means understanding. So if the person with the illness has a deficit there, then you don't want activities to be too complicated. So keep it in small steps. And as I was saying about bathing activities, well, you have all the things together and the clothing all stacked, what comes on first. Ask for help versus telling the person what to do. So that's important. Instead of, do you need some help putting on your socks, or can you do that yourself? Or can I get you something? Do you need your meat cut up? Or do you want help? So it's always, and again, it comes back to respect. You're asking them if they need help versus telling them what to do or going ahead and do it. Attempt to help your family member feel that they are valued, and that's the bottom line, is really important. We just had a thought there, asking for help versus telling what to do. I'm not a technical kind of person, so when I ask one of my children to help me with my computer, they just want to get in there and do it, but then I'll never know how to do that if they don't allow me to learn something. So that can be at all levels. And everybody wants to feel valued and be a part of the family and be a contributor. Activity ideas: folding laundry together, polishing silver, because you can have a chat and you're getting an activity done. Reminiscing about old times is wonderful. And when I think about playing cards with my auntie last summer, we had a great time. Talking about things that we all did together as a family. Watering the plants, or picking off those little deadhead pieces on the plants. Raking, sweeping, baking, going over recipes. It can kind of be a group effort kind of thing. And it's good time together. Drying dishes, shining shoes, putting a memory box together, counting pennies, sorting buttons. So there's lots of things we might think, take for granted, well, I can do it quicker myself, but it's the point of it's quality time and things that need to be done. Approach to care. Remember, changes are because of an illness or disease, and that oftentimes will help with frustration and on the caregiver, stress and things like that. Be aware of verbal and nonverbal messages. I can't stress that enough. And because we can communicate without saying a word, just a facial expression. Break down things into steps. Provide opportunities for success and celebrate them when something goes right and an activity is completed, be it drying the dishes or whatever. Balance assistance with independence, and that might be a little bit hard, to know where you're assisting and whether you're taking somebody's independence away. But practice makes perfect, so you keep trying. Approach to care. Ask yourself if a task needs to be done. If so, does it need to be done now? Again, we don't want to rush activities. We want to take our time. Calm atmosphere at home or in the home is really good. Ask yourself who it matters to, the person with the dementia or yourself. Like, how important is it? Oftentimes I'll say, and those help us understand the illness, the reaction of the illness. And thank you all for your time.